Okay, now we were going to start with the assessment of the head and the face. So for head, you're going to include the size, shape, fontanelles, and abnormalities. For eyes, you're going to be looking at the shape of the eyes, the symmetry of the eyes, any drainage.
Can you look at me, Justin?
Okay. Perla, light reflex. So seeing if the pupils change size when light's on it. For the ears, you're going to be looking at the shape, the contour, position on the head, recoil, drainage, and any cerumen present. And we would be using an otoscope to look into the tympanic membrane. For the nose and sinus, you'll be assessing for drainage, patency, symmetry, pain, any abnormalities, and if the child has an NG tube or an O2 cannula. Also with the nose, you're going to be looking for rhinorrhea, which is like a runny nose. You're going to be looking at the amount.
Can you take a big sniff for me?
Color, odor, and suction if needed. For the mouth and oral cavity, you're going to be looking at teeth, tongue, palate.
Can you say ah?
Odor, dental caries, if there's teeth present. And for our 8-year-old child, we do have teeth present. Any abnormalities, such as thrush, cleft palate, tongue deviation, and pharyngeal drainage.
Stick your tongue out for me. Good job, Justin Bieber.
Now we'll be moving on to the neck, where you'll be looking at the symmetry, any masses, tenderness, and trachea position. And we want the trachea to be midline. Next, we will be assessing the chest and lungs. For this part, cooperation from the child is important, although
Justin, I'm just going to take a look at your chest and pull your gown down a little bit, okay? Good boy.
So we'll be inspecting the chest, auscultating the lungs.
I'm going to take a listen.
Okay. And if the child has any coughing, such as moist, dry, hacking, or if there's any present, loose and non-clearing. For the cardiac, since we're on the chest, we're going to be listening for any heart murmurs, listening for heart sounds, regularity, rhythm, skin temperature in the extremities. So assessing the capillary refills and any chilled skin, color and overall perfusion, any modeling, and the cool distal extremities. And while we're assessing the skin, we can also do the pulses in the extremities and inspecting for any edema. After the chest and the skin and pulses, we're going to be looking at the abdomen.
Okay, Justin, I'm going to take a look at your belly.
You're going to inspect first, then auscultate. Then palpate lightly and deep if there is no pain.
Does that hurt, Justin? Okay.
Okay, now we'll be assessing the genitalia for secondary sex characteristics. And for Justin, we'll be looking to see if he's circumcised or not. And the rectum for rashes, lesions, bruises, and you want to document any abnormalities. Okay. At this point in the assessment, we would be assessing the extremity tone, strength, and symmetry. Strength is graded from 1 to 4+. You're going to be assessing the right to left, then upper to lower tone, strength, and symmetry. So this part of the assessment, we would have the child be standing up.
Justin, can you give me a high five?
Okay.
Kick your legs.
Okay, then we would be looking at the spine and the back.